Hello, my name is Rachel Nielsen and I'm Project Manager with the plugin COTA SA. We are delighted to present you the findings from our latest research project, working in collaboration with Office for Ageing Well SA Health. We spoke to over 900 people aged over 50 years old from all across the state. They shared their views on their understanding, awareness and usage of existing transport services and schemes that are currently in place to assist people aged over 50 years old to travel to their specialist and hospital appointments. These transport services include community council buses or volunteer drivers who are there to help older people attend appointments. The response to the research was excellent, as people very openly and passionately shared their experiences and ideas for how we can improve both the awareness and the usage of these transport services and schemes in South Australia. This video will share what we found as a result of talking to the community about this topic, and we'll also explore where we can go from here. Before we share our results, I'd like to introduce you to two integral people and their organisations involved in the research project.
My name is Miranda Starkey and I'm head of the plugin. We're a social enterprise created by COTA SA, and the work we do is consumer engagement and insights, specialising in people over 50. And our goal is to generate insights that lead to improved products, services and policies for older Australians. Since 2017, the plugin has delivered 26 projects for a really wide range of clients, including the Office for Ageing Well, and we've been thrilled to work with them on this project.
Hello, I'm Cassie Mason, Director of the Office for Ageing Well, and I'm responsible for the development and implementation of state government policy on ageing. An important role for Office for Ageing Well is to work with and for older South Australians to include their voices in the decisions that ultimately affect them. The state government has made a commitment to increasing awareness and use of transport options that exist to support South Australians aged 50 plus to attend hospital or specialist appointments. Office for Ageing Well has partnered with COTA SA's The Plugin to help us fulfil this commitment. The Plugin is well placed to undertake this project due to its strong focus on creating solutions with older South Australians and stakeholders.
The project has two distinct objectives. The first one is about awareness, specifically the awareness older people and their family members across South Australia have of the variety of existing transport services and schemes that are available to attend hospital or specialist appointments. The second one is about recommendations. Really, we wanted to develop recommendations that may be applied to a communication strategy which will increase the awareness and use of these services amongst older people in their communities. In order to achieve these objectives, we designed a research project that had 3 stages. The first stage was a survey of over 900 South Australians. In the second stage, we conducted 6 focus groups in metropolitan Adelaide and across regional South Australia. We are now in the final stage of the project, which is to gather feedback from stakeholders on the insights we have gathered in the first 2 stages of the project. We want to know what is possible when implementing a workable solution to improving the understanding and awareness of existing transport services and schemes, to encourage and increase the use of these services and schemes. So, what did we find out? 75% of respondents had heard of at least one transport service or scheme. There was a lack of understanding of the range of transport services, including what each service offered and the eligibility criteria. Respondents who had both heard of and used a transport service reported high satisfaction with the service, particularly how easy it was to organise and the comfort that they felt when they were on the journey. Overall, we found that, unsurprisingly, for both metro and regional areas, older people and their families rely on a private car to attend appointments. This is also the preferred mode of travel to get to appointments, if they are, in their own words, still able to drive. Overall, the findings showed that if a private car is not an option, the next preferred option is to use a transport service, so the interest in transport services is there. The services are just not front of mind for people to consider accessing.
Sort of thought maybe it's time I looked around to find out if I could be more independent and find something, but I don't know where to go. It's difficult.
These findings indicate that a communication strategy could be a very effective tool to notify people of the services and also to ensure that the communications are targeted in a clear and informative way to increase awareness and consideration when people are planning their transport for specialist and hospital appointments. There are misconceptions about who the services and schemes are available for. People assume the service is for somebody older, more frail, and less capable than they are. This was despite these same people meeting the eligibility criteria for the services.
A lot of people have false ideas about the fact that you've got to be a certain age or you can't take your carer, and you can.
The key here is that we are not looking to alter the eligibility criteria, rather to change attitudes and perceptions, as this is what is preventing people from not only using the service, but also finding out more about the services available to them.
I haven't used the transport service before because I didn't really know that it existed in the city area, metropolitan. I knew that there was quite a bit available for country people.
A communication strategy aimed at increasing awareness and use of transport services and schemes would benefit from addressing the barriers to use expressed by people who do not currently use the transport service. Some of these barriers include, firstly, assumptions about not being eligible. People saying things like, I don't feel like the service is for people like me. Also concerns over the service catering for different levels of mobility and health. Concerns about the reliability of the service, the affordability of the service, availability and timing of the service, and also feelings of pride and the loss of independence. A communication strategy would benefit from addressing these concerns to break down the assumptions and therefore encourage not only awareness, but a keenness for older people and their families to find out more and to use these services and schemes. Within the focus groups, people suggested a range of solutions for how to spread awareness about transport services and schemes. They suggested advertising the services via a range of channels, and the most discussed channels included, firstly, information available in medical and health-related locations, such as at the GP or pharmacy. Participants felt this was the logical place they would expect to find information about services related to hospital and specialist appointments, as this is a reliable and trustworthy location. Also, information received via postal mail to people's homes, including from seniors magazines and local councils, as this will reach people who are not actively looking for information on transport services, but who could very much benefit, such as those who are socially isolated. There was strong agreement that a dedicated website that includes a range of information about the different services available, eligibility, and the timing of services should be available. This would also need to include a central phone number to call to get information or be redirected to local services. People were very clear that online should not be the only place where this information is available, as we still need to cater for the large number of people aged over 50 years old who do not use the internet regularly. That concludes the summary of the key findings from this project. This research was made possible thanks to Office for Ageing Well SA Health, the support from COTA SA, and the guidance from a range of organisations and councils who provided information and support for the project, especially the local health networks, the Patient Assistant Transport Scheme, and the South Australian Community Transport Association. And of course, we thank the over 900 people who contributed their experiences and ideas for the survey and who attended the focus groups across South Australia. As always, the work of the plug-in is only possible due to the openness and willingness of South Australians over the age of 50 to share their experiences with us.